Hi everyone, welcome back to my YouTube channel, and today we are going to talk about parietal bone. And here at the side you can see the diagrammatic representation of skull showing the highlighting area that is parietal bone for the reference. So let's start the video with introduction. Parietal bones are a pair of large curved quadrilateral bones forming the superior and lateral wall of cranial vault. These bones sit on either side of skull and meet at the top of the head along the sagittal suture. Talking about the location and orientation, each parietal bone is located on the upper sides of skull between the frontal bone that is located anteriorly and the occipital bone that is located posteriorly, and above the temporal bone and sphenoid bone that are located inferiorly to the parietal bone. They extend downward laterally to articulate with the temporal bone. As you can see in the diagram, all of its articulations are visible. Talking about its external surface feature, it has parietal eminence, that is a smooth rounded prominence near the center of external surface. It indicates the primary ossification center during embryonic development. Then it has superior and inferior temporal line that are curved ridges running across the bone. They mark the origin of temporalis muscle and temporal fascia. Talking about internal surface features, it exhibits shallow grooves for meningeal vessel, especially the middle meningeal artery. They contain slight depression for cerebral gyri and grooves for venous sinuses, showing close contact with the brain and its covering. Talking about borders and sutures of parietal bone, each parietal bone has four borders that articulate with the neighboring bone through the sutures. They are sagittal border, that is the medial border. It articulates with the opposite parietal bone at the sagittal suture. Then it has frontal border, that is also called as anterior border. It joins the frontal bone at the coronal suture. Then it has occipital border, that is posterior border. It meets the occipital bone at the lambdoid suture. Then it has squamous border or inferior border that connect to the temporal and sphenoid bone at squamous suture inferiorly. Now let's talk about ossification and development of parietal bone. It develops through the intramembranous ossification. It begins ossifying around the 8th fetal week from a single center in each bone. Its complete fusion of sutures occur gradually from adolescence to early adulthood. Talking about its functional significance, it is important for protection, as it shields the upper lateral aspects of brain, mainly the parietal lobe. It is important for sport as it contributes to the overall dome-like shape of skull, offering structural integrity. It is important for attachment as it provides sites for muscles and facial layer involved in jaw movement and head posture. Now let's talk about clinical significance of parietal bone. The first is fractures. They often result from direct trauma, may affect underlying blood vessels and cranial content. Second significance is surgical landmark, as it is used as a landmark for procedures like craniotomies. Third significance is craniosynostosis, that is premature fusion of sutures involving parietal bone, and it can lead to abnormal skull shapes. Now let's talk about the conclusion of this lecture video. Though often overlooked, the parietal bones are crucial guardians of the brain architecture. With their strategic position, they not only form a major part of cranial roof but also serve as a landmark for both development and clinical procedures. And this was all about parietal bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.